Track the length of your illness. In general, viral infections are milder than bacterial infections, but they tend to last longer. You will feel very sick for 1 to 3 days and then you will start to feel better, but some of your symptoms may linger. Symptoms that linger for a week or more may be a virus. It's important to stay vigilant and talk to your doctor about antibiotics if symptoms last for a while. Viruses can morph into things like sinus infections or increase the risk of middle ear infections, which may result in you developing a bacterial infection as well. Pay attention to the color of your mucus. When you blow your nose or cough up mucus, pay attention to the color. While it may feel a little gross, color can be an indicator of whether you have a viral or bacterial infection. Thin and clear mucus is more likely to be a viral infection. Dark, greenish mucus is more likely to be a bacterial infection. However, mucus color is not a 100% accurate indicator of whether you have a viral or bacterial infection. Make sure to weigh in other factors. Observe your throat. A sore throat is common for both viral and bacterial infections. Checking for a sore throat is the most common test that will be performed in your doctor's office to determine if you need antibiotics right away. Certain types of sore throats can indicate a bacterial infection. For example, white spots are generally caused by bacteria. A sore throat without other symptoms, such as a runny nose or sneezing, may be a bacterial infection such as strep throat. Evaluate your fever. Fevers can be present in both viral and bacterial infections. However, fevers differ slightly with different types of infections. In bacterial infections, fevers tend to be higher. With a bacterial infection, fevers get worse after a few days while they tend to improve a few days in with a viral infection. The normal human body temperature runs between 97.8 degrees Fahrenheit, 36.5 degrees Celsius, and 99 degrees Fahrenheit, 37.2 degrees Celsius. Reflect on your likelihood of having the flu. The flu is caused by a viral infection. If the flu is going around your office or place of work, remember it's highly contagious. If you've interacted with people with the flu recently, there is a good chance your symptoms are caused by the flu. Keep in mind that there are treatment options for the flu if you are diagnosed and your symptoms started within 2 days of being diagnosed. Make sure to contact your doctor's office about your symptoms during flu season. Think about age. Younger children are more prone to certain viral infections. Upper respiratory infections specifically are more common in younger children. If your child is displaying symptoms like a sore throat, sneezing, and coughing, they may have an upper respiratory infection. If you believe your child has an upper respiratory infection, take them to see a doctor. Recall recent sinus infections. Sometimes, bacteria can start as a viral infection and morph into a bacterial one. If you recently had some kind of viral infection, such as a sinus infection, you may have developed a secondary bacterial infection. If you have had 2 illnesses close to one another, you may be more likely to have a bacterial infection. In some cases, other viral infections could lead to a bacterial infection. Any illness that lingers for more than a couple of weeks should be evaluated by a doctor. See a doctor right away if you have certain symptoms. Most viral infections can be managed at home with self-care. However, under certain conditions you should see a doctor right away. It's especially important these symptoms are addressed in children. See a doctor if you notice any of the following symptoms: urinating less than 3 times in 24 hours, difficulty breathing, no improvement over 3 to 5 days, worsening of symptoms, or severe symptoms. Take antibiotics for a bacterial infection. Antibiotics are used to treat bacterial infections and will not do anything to stop a viral infection. Doctors may not always prescribe antibiotics, even for bacterial infections, but they may be necessary if your infection is serious. Try over-the-counter medications for pain. If a viral or bacterial infection is causing you a lot of pain, ask a pharmacist about what over-the-counter pain medications may help. Make sure you use medications according to package instructions and ask a pharmacist whether they will interfere with any existing medications. If you are prescribed an antibiotic, ask your doctor about which over-the-counter pain medications are safe to use with your antibiotics. Stay up to date on your vaccinations. It is important to stay current with all recommended vaccines as they are meant to prevent serious complications from both viruses and bacteria. Get a flu vaccination to protect you from the virus that causes the flu. While the flu is a viral infection, viral infections can sometimes lead to a bacterial infection. A flu shot can reduce your risk of developing viral and bacterial infections. A flu shot will not protect from all viruses or bacteria. While it reduces your risk, you may still get sick.